Hi, I'd like to take a moment to tell you about a new pain treatment program called Neurofunctional Pain Management, which is now available in Arizona as a mobile program. As a mobile program, one of our nurses will come out to your home and actually perform this treatment on site at your house, at your home. The treatment itself, neurofunctional pain management, it's a three-part treatment program using high pulse electroanalgesic therapy, an IV nutritional therapy, and health coaching. And this combination of therapy and treatment has had an amazing success rate of 85% across a very wide range of pain conditions. We treat about 2 dozen different types of pain and issues related to that, and we have a great success rate with this. So over the years, we've worked with many doctors around the country, treated thousands and thousands of patients with this program, and all of these doctors will collect their results on their own. They'll report back what their success rates are with all of those patients. And across the board, the average is an 85% success rate of those patients have achieved a greater than 50% reduction in pain, which is the objective most of these doctors around the country are aiming for when they work with patients in the program. So the program is an 8 week long program. You've got a duration of effect that needs to occur for there to be an ongoing outcome. So when we have a patient that ends up in the program, let's say that they started out on the pain scale of a 7 or an 8, and we get them down to a 1 or a 2 over the course of 8 weeks. We expect that to endure, to last for several months. Historically, most patients who have a successful outcome will end up maintaining that outcome for several months. We aim for 3 to 6 months for that. A lot of patients have gone quite a bit longer than that. I've seen many patients that would go 6 to 8 months. Some of them have gone over a year. Had a patient once come back in just over a year later saying that he was still almost entirely out of pain after a year from completing the program. So that's one of the reasons why the program is an 8 week process, is because there's accumulation effect of outcomes, and that's related to the treatment components themselves. Electroanalgesic therapy is a high pulse electrical current. It's very different from some of the other electrical simulators you probably heard of, like a TENS unit. Some people are familiar with those. TENS units are great. They're muscle stimulators, and they do a lot of great things in certain capacities. But electroanalgesic therapy is quite a bit different. It's actually more of a neural stimulator. It actually produces a concept called depolarization. It can actually produce pain relief, and it's an FDA cleared modality for treating pain specifically. So that's one of the reasons why we use it. So it works amazingly well, and it's actually been an FDA cleared technology and device for this type of treatment for over 30 years. So this is not some brand new thing in the market that's unproven. This is something that's very established, and doctors around the country do use it and they know about it. Uh, the other component of this therapy is an IV hydration or nutritional therapy. This is something that we find most patients suffering from chronic pain typically are. One, they're typically chronically dehydrated, just not having, not drinking enough fluids in general, and they're typically have some sort of chronic nutritional deficiency, some sort of vitamin deficiency, multiple in a lot of cases. So adding that IV to the actual electroanalgesic therapy is a pretty strong combination. There are some more intricate relationships between that IV and the electrical therapy that cause the treatment to work so well. Some of that gets into some more complex physiology conversations, but needless to say that over the years, doctors that have done just the electrical therapy, and then the doctors who have done the combination of those two, have noticed the combination tends to create stronger outcomes that last longer. That's one of the things that we've noticed with doctors working with this program for years as well. And then, of course, the last aspect of this is the health coaching. And with the health coaching, you've got the nurses that will be with you that will go over these different topics with the patient, and review these things with you in the form of a health coaching event while they're actually conducting the treatment with you. So what types of pain? Any type of chronic musculoskeletal related pain. You've got one of the most common ones, neuropathy. It's a very strong one. Neuropathy, knee pain, back pain, sciatica, fibromyalgia is a very popular one as well, and as well as some other kind of call them specialty pains. If you're listening or watching this video, you probably don't think of it as a specialty type of pain, but there are some more rare types of pain conditions that most people do not have, but some people do have them, and we can treat those as well. Some of those would be trigeminal neuralgia, and plantar fasciitis is another one. Not everyone has, but they are pretty severe when they do have those. And this treatment program works amazingly well for all of these. So I encourage all of you out there who have a chronic pain issue to consider working with Relative, the company here that we're working with in Arizona that offers neurofunctional pain management in a mobile treatment program. Uh, all you have to do is fill out the form online and get started with one of our nurses. They'll come out to your home, perform the treatment on site. Neurofunctional pain management is, again, non-pharmaceutical, non-surgical, non-invasive, and non-chiropractic. So we're actually coming to your home and actually treating you with the electrical device on site in your home. I encourage all of you to consider this as your first option for chronic pain treatment. In my opinion, in many opinions, it's better to go with this safer, conservative route that will likely work for most people rather than to go down the path of medication, surgeries, and interventional procedures and steroid injections of all sorts. To be able to do something like this that's safer and conservative and actually effective is typically the first choice for most doctors and for patients. If you let the patient decide, typically patients will want the safest, most effective thing they can get. That's, again, not risky for them. Oh, I should also mention too, this entire treatment program is covered by Medicare and commercial insurances. It's just a matter of doing a quick verification with your insurance to make sure that it is covered, verify the coverage with it. It's not a matter of if the payers will cover this particular treatment. It's just a matter of some patients having the right need and such for their insurances to want to cover the program, but they will typically, most patients are able to get this covered just fine. So reach out to us, get started. It's very simple to look into this and see if it will work. We have coverage across the nation for this. But here in Arizona, we are just getting the program up and going. We have several nurses available. And again, we are a mobile pain treatment program, and we have nurses who will come out to your home and treat you on site. I very much hope that you reach out to us and let us work with you on treating your pain issue and your pain condition. Reach out to us, follow the link here that I'll provide, and I look forward to seeing you in the program. Thank you.